Welcome to this rapid executive explainer. Today, we are diving straight into the global health promotion strategies laid out by the Bangkok Charter of 2005. For leaders and policymakers tuning in, understanding these mechanisms isn't just about public health, it's literally the bedrock of sustainable global strategy. So let's get right to it.
Let's start with the absolute bottom line up front. The ultimate strategy for global health investment? It's simple. Prevention is better than cure. That right there is our primary target. Investing in preventative care yields the absolute highest strategic, economic, and social returns. Think about it. It is fundamentally so much more efficient to prevent a crisis than it is to scramble and manage one after the fact.
So how exactly do we achieve that? Enter the PIRAB strategic framework. That stands for Partnership, Invest, Regulation, Advocate, and Build Capacity. These 5 core pillars aren't just concepts. They are the required actions to drive truly sustainable initiatives. Let's quickly break down how your organization can execute each one.
The foundation starts with partnership. And listen, we need to move way past simple transactional vendor relationships here. We are talking about building true strategic alliances. You've got to systematically identify target partners, define shared strategies, and build deep trust through communication. From there, rigorously monitor your KPIs to drive long-term sustainability. It's really all about engineering a genuine win-win ecosystem.
Moving right along to invest, as executives, the real game-changer concept you need to embrace is double returns. You must align your financial growth with real, tangible social impact. On one side, you're targeting economic returns by backing high-growth health tech and innovation, but simultaneously, you're aiming for tangible returns. We're talking long-term cost reductions, a major boost in productivity, and a vastly improved quality of life for society.
Next up is regulation. Look, strategic regulatory design is crucial because it protects populations while still maintaining that necessary economic flexibility. By sticking to better regulation principles and running rigorous regulatory impact assessments, or IRIs, you make sure new policies are fair and free from unintended negative consequences. And of course, active stakeholder engagement is absolutely critical to make this actually work in practice.
Now, to push those regulations forward, we have to advocate. But let's pause for a second, because we really need to separate advocacy from lobbying. They are not the same thing. Advocacy is a broad approach. It targets the general public to build awareness and generate serious social momentum. Lobbying, on the other hand, is a highly narrow, targeted effort aimed at specific authorities to change precise laws. Knowing exactly when to deploy which tool is a masterful executive skill.
Finally, we arrive at the B, build capacity. Simply put, to execute the PIRAB framework, you need serious internal structural strength. That means constantly running needs and gap assessments, investing heavily in targeted training, optimizing your workflows, and upgrading your tech infrastructure. Wrap all that up with strict continuous monitoring. At the end of the day, your organization can only perform as well as its foundational capacity allows.
So, what does this all mean for us? It all comes down to application. How will your organization integrate this PIRAB framework to drive those double returns and create sustainable health outcomes? I challenge you, as leaders, to take these 5 strategic pillars and weave them right into your overarching business strategy starting today. Thank you so much for joining me for this Executive Explainer.